So today we're going to talk to you about a project that we've been doing now for over 2 years, an innovative interdisciplinary approach to cancer care at Nepean Cancer Care called Removing the Band-Aid Effect. I'm Dawn.
And I'm Jackie.
First of all, before I begin, I'd just like to introduce you to Grant. Grant is a 36-year-old man. He was diagnosed with a malignant sarcoma. We will come back and discuss Grant a little bit further in our presentation. And this is where we work, Nepean Cancer Care, at the foothills of the Blue Mountains. Currently, the Allied Health Oncology Specialty Team at the centre are operating independently from their professional departments. This comprehensive interdisciplinary service was established to support the support care needs of cancer patients throughout their cancer journey. The Allied Health Service is experiencing the demands of a growing cancer care service across both outpatient and inpatient settings over the last 16 years. The centre has been opened. The overall occasions of service have risen from 19,000 to over 80,000 per year. This averages at 8% growth per year. Due to the increase in clinical workloads, sole clinicians within the Allied Health team need assistance from their main departments, and this has contributed to a silo phenomenon that compromises multidisciplinary team approach. The outpatient service has been cut to maintain the Allied Health inpatient demands, and our Cancer Allied Health outpatient clinics are experiencing long waiting lists. Our group sessions for cancer patients have since been cancelled. The occupational therapy home visits are limited, and formal education sessions to promote the service to staff and patients no longer exist. Our outpatient referrals are often not seen promptly, resulting in a longer length of stay, access blocking, or patients simply being discharged with any Allied Health follow-up. Currently, patients attending Nepean Cancer Care for treatment have no easy access into the Allied Health services, and this contributes to more crisis inpatient referrals, hence being called the Band-Aid effect. The Allied Health team recognised the reality in current budget restraints in a growing population, and we are not proposing the solution to this problem is more Allied Health staff, but to investigate, identify and implement changes to improve the current cancer journey. For successful implementation, we needed to gather some diagnostics, and unfortunately we don't do that very well in Allied Health. So we had to look at ways of how we could capture that, and that was through looking at patient and carers and staff surveys. We interviewed our professionals at Nepean Cancer Care, and it showed that within a month over 20% had not referred to any Allied Health staff. We also conducted patient stories, and they were transcribed and identified many issues relating to the Allied Health support and coordination, which included there was nothing we were offered, did not see any Allied Health services throughout their journey. We needed an equipment towards the end, absolute nightmare. It's like the service didn't exist. Services came too late, and a dietitian would have been useful. We also conducted a survey in our waiting room, and the survey, one of the questions was, throughout your cancer treatment journey, would you have benefited from Allied Health service? A staggering 90% of patients agreed that they would have benefited from our service. So the project was to look at limiting the number of patients seen in crisis and remove the Band-Aid effect.
So overall, our project aim was to improve the quality of life for our cancer patients and their carers via a sustainable and an innovative interdisciplinary team approach. And therefore, we will meet the needs of our cancer patients and their carers and remove this awful Band-Aid effect. So our objectives, as you can see, particularly in terms of our access for our patients to care and the use of the allied health services at that point in time, did not particularly look good. And as a team, we put down some projections to improve that specifically. So in terms of our clinic waiting room, we aim to reduce to 1 to 3 weeks instead of the current 2 to 6 weeks at that point in time. Our clinic did not attend. We wanted to particularly reduce, and as well as a high number of clinic cancellations. And also we wanted to really look at reintroducing regular occupational home visits. So through our diagnostic phase, we engaged with major stakeholders. We got our team together, we discussed with our steering committee, and as you know, we've actually engaged with our patients through surveys, as well as doing detailed patient stories and getting their feedback. We were able to summarize the key issues, and it was clear to us that it was around communication, perhaps no surprise there, but also on our complex referral processes that was currently in place across cancer care services. And there was a lack of prioritization. We were not looking at the referrals, or the quality of the referrals were coming to us. We didn't have the insight. There was a definite lack in how we were promoting and educating our service. And there was a poor balance between how allied health was spending the time in the inpatient setting versus how we were spending our time in the outpatient setting. And often, if we discuss this as a group, this was something that was very challenging for the allied health staff. And it was also very obvious that we had particular problems.
Did you smile?
We had particular problems with our clinic's productivity in relation to when staff needed to take leave, as we had limited cover at that point in time, which obviously impacted on the care that we were providing to our patients. So again, through various solution focus groups and engaging with significant stakeholders and setting our solution owners with our sponsors, we were able to agree on some key solutions to address these particular problems. So we were working on regular occupational therapy home visits. We've established a standardized allied health referral process for our outpatient service. We looked at a way of, across all allied health disciplines, to set up a system where we can prioritize and make sure that our high priority need patients gets privilege and gets seen on time. We had inpatient, the referrals that we've negotiated perhaps didn't need to be seen in the inpatient setting, but can be seen in the outpatient setting. We've developed, recommended an information brochure for our patients about the allied health service, as well as addressing education, so regular in-service for our clinical staff across the cancer centre. And then we've also proposed perhaps some assistance for allied health through an allied health assistant. Something which you also felt in terms of productivity for the clinic is just a simple solution, but perhaps not always that easy in terms of sending an SMS or text to confirm and remind appointments, and definitely focus on how we're going to tackle our leave planning so that service doesn't necessarily need to stop, but it's continuous and available for our patients. With our implementation was last year in April 2015, and it was very important for us to keep track on how, with our implementation of our solutions, and how we were tracking with our objectives. And this is just illustrating on how we were monitoring on a monthly basis. At that point in time, we were using and still is, using our Mosaic system to actually track on how we're performing within our different disciplines across the clinic. So where are we at today? So it's very exciting for us to say that we've made our projections. We said that, and to actually be able to show now after 2 years that we are still running on track, particularly for our, in terms of waiting time. We feel very proud that we can say that our patients, particularly our high priority patients, are getting seen on time. And we have a significant reduction in our clinic did not attend, some cancellations. Perhaps that's an area where we can still work on. And we're very excited to say that we now have regular occupational therapy home visits for our patients as well. So I'll just hand you. So in terms of just the outcome of the project in general, we also have our regular education programs for medical nursing and other health professionals across Nepean Cancer Care Centre in place. We are collecting our allied health data on a much more regular basis. We are engaging effectively with our referrals, and we are reinforcing our prioritisation system, so seeing patients on time, and we've definitely improved our care coordination. Like I said, our occupational therapy service is now able to facilitate regular home visits. We also have made available an orientation package for patients and carers around what the service is all about, and we're continuing to promote this specific model as we are today.
So the new patient journey, how does it look today? In words, we've been able to inform and make people aware of the Allied Health Service. We are seeing patients now more timely and appropriately. Staff can guide patients to the Allied Health Service, and the patient will receive an interdisciplinary and innovative support service and an effective Allied Health outpatient service, which limits the crisis care in which does not impact on the inpatient ward. But more importantly, this brings me back to Grant. With the initiation of our new project, we have been able to get in early with Grant. Grant had a lot of multiple issues. He had financial issues, he was depressed, he wasn't eating. Throughout his illness, his function had declined, and for me, he was unable to lie down and sleep in the bed. I was able to go out and do a home visit on Grant, one of many home visits, and one of his goals was to sleep more than 2 hours of a night. His sleeping position was in the toilet, sitting on an over-toilet, resting his head on the door. Due to this project, we made time to go out and see him, and on his discharge, we discharged him home in a chair, obviously not a standard chair, and he was able to get 7 hours sleep on his first night. He was able to get input from our social work to help him with the financial issues. At one stage, he became quite suicidal, and we referred him to the clinical psychologist. And his last goal was to be able to lie down in bed with his partner. And as you can see, with multiple inputs, we were able to facilitate that for Grant, and he was able to lie down. That took a lot of time. Grant came into our ward one last time. We were able to send him home with all the services in place, with all the care needs that he needs from a collaborative team approach. Grant was able to have a good death, surrounded by family and friends in his own home, lying down in bed with limited pain. For the team, we were able to remove the Band-Aid effect and provide a meaningful and holistic approach to Grant's care needs. Just very briefly, with the project, we have now got a new data system in place called Mosaic, which my colleagues have been very hard at working and collecting data. We're also looking at implementing an SMS system, which will hopefully decrease the cancellations and waiting time. In our service plan, we are looking at providing an allied health assistant, a dietitian and a social worker, which is fantastic for the team. We have an agreement across all allied health on leave procedures, and we've been able to sustain this project by the involvement of the holistic collaborative team at Nepean Cancer Care, great team to work with, We've been lucky and privileged enough to present at conferences, and we also have been able to do orientation to new staff on the Allied Health Service.
And I guess I just would like to just share a few lessons, because it was a significant project that we've taken on with quite a few people involved, and we've just highlighted a few things that perhaps people can take home in terms of whether, particularly in terms of what is the role of your sponsor, making sure that that you get that support all along, and also just valuing you know, how important it is across the project to monitor your progress through, you know, accurate data. And we just would like to acknowledge the people on the slide that was quite instrumental in getting this project done and successful, and we'd like to thank you all.